Workforce has been a challenge for health centers for a number of years, and it's across the board. It's from providers, staff, to nurses, medical assistants, and even our front desk staff and community health worker staff. Anytime we have a vacancy in a health center, it does a number of things. It puts an extra demand on the staff that's already there, that's running kind of on a skeleton crew at times, which impacts patients. And it's been a real challenge to find people to fill the roles.
My name is Sergio Zulich, a pharmacist and also program manager at Coos County Family Health Services, part of the group that's working on the White Mountain Medical Education Consortium for the Family Medicine Residency Program. Most residency programs are hospital-based. This is somewhat of a new concept, training family medicine residents in the community setting. It provides certainly a real-life type of experience, and it does provide health services for part of the community that is underserved. So it's a great way for a medical student to get experience. The plan is to have a number of rotations involved with things like dealing with chronic diseases, learning how to address substance use disorder. So being able to train primary care residents to how to deal with, or at least triage, some of the issues that could come up is a big plus for the community.
It's been very difficult in the North Country especially to attract and retain physicians who are trained in family medicine, general internal medicine, and sometimes pediatrics. So the recruitment and retention of qualified physicians is very difficult. It is hoped that we can provide a very strong educational program for our developing physicians, and that they will potentially stay in the North Country. As you've heard, there is a percentage of residents who do stay after completing their residency program. They've gotten used to the area, they may have families, they may be involved in the communities, and that's just what we like to see.
In 2019, we received some funding from the IDN, which is the Integrated Delivery Network, as a result of work that we had done with that grant program. And that funding was specifically targeting workforce retention and recruitment. So from that funding, we have helped 8 individuals advance their careers, and none of them have left. It's expensive to hire people, and when you find the right people that are a part of your team, you really want to keep them, and they really want to stay. So we've helped someone who started out in medical records become a community health worker, and she's doing outreach work and is really thriving in that position. We have a nurse practitioner who went on to get her psychiatric mental health certification. We have a medical assistant who is currently in nursing school and will be graduating this May, and another medical assistant who is just starting nursing school. We have a nurse who went on to get her BSN, and another nurse who is in the process of getting her nurse practitioner. So a lot of grow your own, and like I said, all of those people have stayed with the health center, which is really remarkable.
As the Director of Community Health Services at Harbor Care Health and Wellness Center, I work with a group of community health workers who serve as a bridge between the community and the healthcare system and social services organizations as well. The simplest way to define a community health worker is a community member who serves as a bridge, connecting the community members, the individuals that we serve, with the services that they need, whether it is healthcare related or social services related. So they understand the community where they live, they understand the needs of the community, and they also understand the healthcare system in the United States. So it promotes relationship building, and it strengthens and empowers the community to be able to advocate for themselves and to receive the care that they need.
Community health workers are integral to meeting the mission for our health center, because our mission is to provide good quality health care regardless of ability to pay. And it's really hard for someone to focus on their health and well-being if they have other things going on in their lives that impact their ability to focus on, let's say, their blood pressure. If your lights are getting turned off tomorrow, you don't care if your blood pressure is high, you're focused on keeping your lights on today. So the role of a community health worker is to identify some of those things, some of those barriers that individuals or families might be facing that are keeping them from, taking care of themselves and staying on top of whatever health related thing they have going on.
Our community health workers are bilingual, or some even trilingual, so one of the services that we are able to provide to our community is language access. We realized that many patients were missing their appointments because they felt insecure that they did not speak the language of their provider. It is another area that community health workers are able to assist because they are trained medical interpreters, so they can accompany that patient in their appointments to ensure that the patient understands what the provider is saying and to ensure that the provider understands what the patient is saying. And the result is a healthier population.
The role that I see a community health worker doing is working themselves out of a job, because hopefully we're giving them the skills to be able to do these things going forward, ideally without our support. I mean, we're there to support if they need it, but ideally if we've done it well, then they're set up to navigate these things on their own. We started these resource notebooks, so we set families up with a notebook, and it's structured to meet their specific needs. So what goes in it, it really depends on what's happening in their lives. Applying for things requires a lot of documentation. So if the notebook is set up, then all the information is where they can readily find it, but they just bring it when they come to an appointment, and usually everything that we need to help them do whatever it is we're working on is in that notebook. It's a great tool to build self-confidence and one skill set to navigate life and feel like they can do it better than they did before they walked through our door.
Grants are a blessing, but they are not sustainable. They expire or they don't renew, and it leaves us with programs that we started who are successful, needed in the community, and all of a sudden we are not able to continue those programs for lack of funding.
I've been the director of the Area Health Education Center for over a decade now, and prior to that I was a deputy director for 5 years. Our focus is to build the workforce and to support the workforce, and in order to do that we have to identify the needs, and we do this through our needs assessments. And one of the needs we recognize is that we're losing people in our state. Students from certain areas tend to go back to those areas after they've graduated. So our strategy is to grow our own workforce. Students from New Hampshire, we focus on those students and train them and expose them to a wide variety of health professions and guide them in ways to come back to New Hampshire to work.
I came to this country back in 2009, and my only intention was to get a job. I wasn't looking for any education, just getting a simple job. When someone introduced me to the AHAC program to get certified as an interpreter, medical interpreter. And I remember Florentina getting up one by one, standing up, asking us where we're from and how long have we been in the country. And I remember I was like 7 or 6 days new in the country at that time. So that's when I started to at AHAC. That was my first thing in this country, and it actually opened up my eyes to keep looking for further education.
So what we do is we build programs and we work with students in the state. We've started with middle school students, we work with high school students, and we work in the communities where the students live. We bring the programs to them and we support them where they are. And our focus is to expose students to a wide variety of professions within healthcare. And then I run a program called Health Careers Institute at Dartmouth, and we bring students to Dartmouth campus during the summer months, and they live in the dorm, and we bring them to various health care settings in New Hampshire to show them and to work with and interact with professionals in those careers.
It's a very exciting quest to have a residency program, and really, like the adage of a rising tide raises all the boats, this is a true experience for everybody, from the front desk people to how the nurses interact with patients and what they learn from the residents and vice versa. So it's really a really fun way to reinforce education in general, medical education, and it's exciting to see the maturation of these young men and women in the profession.
I think it's important that a program like this gets off the ground. Certainly it's helpful for the North Country, but I think in general it's good for the state. You know, they start as a first-year resident, and by the time they're third year, you know, the hope is that they've actually formed a good relationship with people in the community and have a connection to the area.
The program is really expensive. It's something that we felt strongly in investing in, to the point where our agency built that into our policy and procedure as it's an employee benefit, and it's something that we really we would like to make sustainable. And it's been really fun to see our medical assistant, for instance, who's currently in nursing school. She's been working closely with one of our nurse practitioners and seeing the nursing role from a different light. So she's not only in school, but when she's working, she's able to think about her role in a different way and how it's going to change when she becomes a nurse, and she's very excited about that.
I think with all the new coming immigrants that we have into the country, they need a lot of education, not only in terms of culture or anything that is associated with the state, but also medically, because that's going to decrease cost and it's going to increase knowledge at the same time. As if we have a population that is well educated, that's going to decrease chances for being hospitalized or getting an infection or not being taking medications the proper way they're supposed to be taken. So I believe in education that way. So that's what I decided to come to New Hampshire, because I want to further my education here. I want to go for a master's degree in education and trying to continue educating the population here so we can continue doing a better job here in New Hampshire.
Our team is from New Hampshire. We are committed to New Hampshire, and we love our state, and we want to see our workforce grow and succeed and provide quality health care for the population in the Granite State, because this is where we also live. We grow we raise our families, we work, we play, we love the state.